First and foremost, happy holidays, Merry Christmas to everybody out there. And thank you for being here at this last press conference last scheduled press conference anyways, before Christmas. I want to start today by recognizing that Rhode Island is witnessing a heartbreaking milestone in our ongoing fight against the COVID-19 pandemic. 3,000 Rhode Islanders have lost their lives due to the virus. That is 3,000 mothers, dads, brothers, sisters, sons, daughters, grandparents, friends, and neighbors who will be missed, especially during this holiday season. This is a moment that we will not forget, and one that I hope will serve as a call to action to save countless more lives as we continue through this pandemic. Unlike when the pandemic started, we have the tools to keep ourselves and our loved ones safe. Get vaccinated, please, and get your booster. And although the death rate has slowed down, one life lost is one too many. The time now and every day counts. In honor of the 3,000 Rhode Islanders who have lost their lives, we will be lighting the State House blue and gold tonight in their memory. And following this press conference, I will be directing flags across Rhode Island to be lowered. We know that President Biden will be making some announcements shortly, and my team has already been in touch with the White House today, and we will continue to work closely with them to ensure Rhode Island gets the support that we need. On testing and vaccination capacity, I want to address the work that our team is doing to expand testing and vaccination capacity in Rhode Island. Tom's here today representing a whole team of people that have been working around the clock in a way to address each and every change in terms of the COVID that it comes up. And I want to thank Tom for that, and also the Department of Health and all the related resources that Tom can explain that we'll be using to address this testing and vaccination capacity. I'd like to remind everyone that we were in a ramp-down strategy just before Thanksgiving. Things changed, and as a result of that, we're changing again, and I've made it clear that a whole government COVID response team, priority number one is make sure that the testing and vaccination continues to lead the country in that category. We have, like I said, Tom is here with today. He's been working on these issues. Let's start with testing. I want to give Rhode Islanders an idea of where we are. Rhode Island continues to test at rates that are highest in the country. Higher than 48 other states at the moment, and we are currently testing about 10% more than our peak last year. To give you a sense of the scale on some days, Rhode Island is doing more than 20,000 tests a day. That includes K through 12 in our schools, at pharmacies, and across our state at both local and test sites. That's why we set a goal to expand our testing infrastructure by 50%. We're expanding capacity beyond what it was last year. And I also would like to say, look, last year, we compare last year and this year, there was higher infection rates last year than there were this year. But in ramping up to meet the need, and we want to encourage people to get that testing, and we'll meet that demand. So here's an update on our progress. Yesterday, we opened a new rapid test site at Chapel View Shopping Center in Cranston. This site will be open 7 days a week for rapid testing, and to make an appointment, you can visit portal.ri.gov. That's portal.ri.gov. And we will be opening additional new rapid testing sites in the next couple weeks. As we announced yesterday, we are expanding access to rapid testing at 6 existing sites for Rhode Islanders to get tested who are asymptomatic but are looking for a test before the holidays. These 6 sites are located in the Barrington Shopping Center, the Blackstone Valley Community Health, Cranston Parkade Storefront, Rhode Island Convention Center Ticket Booth, Smithfield VFW, and the Warwick Shopping Plaza. Testing is also available for symptomatic people at these locations as well. Here's what's next. We are currently onboarding an additional laboratory to process PCR tests and reduce turnaround times. This will give us the ability to process an additional 5,000 PCR tests per week. And to ensure the highest level of preparedness, we are planning to further expand lab capacity with another company. Having multiple vendors here is important, especially in the case that one vendor has an equipment and staffing issue. Staffing is clearly one of the most challenging issues right now, as we know, not only in the hospitals, but around the healthcare industry and beyond. And that seems to be the one that we really need to figure out. But staffing is causing a great deal of pressure on the services that we know that we need to provide and will continue to provide. So we're going to continue to double down our at-home rapid test strategy. We've distributed all of the 100,000 rapid tests that we announced last week. These initial tests were targeted toward hard-hit communities where individuals may be to pay out of pocket for rapid testings for the families. They may not be able to pay for those rapid testings. We have good news on the 1 million additional rapid tests that we requested from FEMA. Our team in the Department of Health has obtained purchase orders to these tests, and they are currently working with the vendor to secure delivery dates. Our goal is to distribute 1 million at-home tests by the end of January. And we will continue to make 1 million at-home test kits available monthly through at least March. We will be distributing these tests to all 39 cities and towns through municipalities and community-based organizations. In addition to testing, we're also expanding our capacity to get shots in the arms, especially booster shots. This week, we extended operations at both Saconaset Crossroad and East Providence vaccination sites at least through the end of December. We're also working to open 2 additional mass vaccination sites. And we're moving full steam ahead on expanding our vaccination capacity by once again partnering with our cities and towns. And I want to make it clear that the cities and towns were great partners when we were trying to ratchet up our vaccinations during the spring and the summer. And I've met with them. We have an additional meeting this afternoon, and we fully expect that people will have the option to get their booster shot locally, as one of my family members did in East Providence this weekend. So our message continues to be the Rhode Islanders is that the work continues. We want to make sure that we're flexible in terms of responding to the challenges that we don't know what are around the corner, but we're definitely working to be up to the task, and I believe that we are. So please, what you can do is get vaccinated if you haven't already been vaccinated, and get the booster shot if you already have got vaccinated. Part of that work, which has been ongoing with the health department and partnering with with our office, is the 401 Health app. In case you missed it yesterday, in collaboration with the Department of Health, we launched the 401 Health app. Before I came on board here today on this conference, I was told that there's been 3,500 downloads already on that app. So thank you for downloading. We encourage you to download this information as well. It's good for our preparation and to be prepared on what we're dealing with right now, but also what might be coming down around the corner. That's we don't know what to expect, but we will be prepared. It's meant to be an easy, convenient, and secure way to store your and your family's digital COVID-19 vaccination records with just the touch of a button. We joined 8 states, including Connecticut, just announced, and Massachusetts will be rolling out their version soon. Many of the countries and pharmacies across the state who are offering the smart health card technology. You can download your 401 Health app in the Apple App Store or the Google Play Store right now. I was able to do mine this morning. And if you don't see your booster record right away, it's there. Just swipe to the right. Swipe to the right. One of our most critical issues that we're dealing with right now is hospital staffing. And as I said last week, you've heard from doctors themselves, our hospital systems, like hospital systems around the country, are experiencing enormous pressures due to staffing challenges, rising COVID cases, some burnout from the staff as understandably, and of course regular emergency situations. This is exactly why I put in place mitigation measures like masking and proof of vaccination last week. Additionally, as I mentioned last week, we have partnered with our hospital system to request FEMA personnel to deploy to Rhode Island to assist in our hospitals. And we're awaiting word on our request to FEMA. Let me tell you some of the additional steps that we are taking to address this issue. My team is in conversations with General Callahan. I spoke to him as recently as about an hour before this meeting to explore National Guard troops in our hospitals to assist with non-medical administrative functions which could alleviate stresses on nurses, CNAs, and other medical professionals. If someone holds a valid license in another state and wants to come to work in a hospital in Rhode Island, we will begin granting them a temporary license immediately. We have been doing this for nurses since the start of the pandemic, but yesterday we expanded this for other professionals working in hospitals. We are also expediting the Cna licensing process, and we have launched a broad communications campaign in partnership with the hospitals to educate the public about when to go and when not to go to the emergency rooms. Use your primary doctor, use your local emergency clinics. That's an option to give some relief to the doctors and the nurses and the personnel at our hospitals. The state police are also working on implementing a statewide system of emergency medical dispatching, which will coordinate with EMS statewide on the E911 system. So before I turn things over to our Lieutenant Governor, I want to make an important announcement for Rhode Islanders who are struggling to pay their bills this winter. Rhode Island has received over $21 million for the federal low-income home energy assistance program known as Lyheep. This funding will help renters or homeowners pay heating bills or respond to a home heating crisis like the heat shutoffs. That $21 million on top of the $30 million in American Rescue Plan Act funding for this program. And as we've mentioned many times, this in Providence CCRI campus, our office, along with the Rhode Island Housing, partnered in last week with a sign-up. The Lieutenant Governor was there as well with us to continue to work on that rent relief program, which we're approaching almost $90 million of distribution, and our goal is to distribute $200 million between now and September, the end of September 2022. We're also announcing another federal program that will help Rhode Islanders pay the cost of water and wastewater bills. It's called the Low Income Household Water Assistance Program. It offers one-time payments up to $500. It will begin in early 2022. More details on that will be made available in the near future. These grants will be administered through the Community Action Program agencies across Rhode Island, and we thank them for their leadership. Our CAP programs have been instrumental during the time frame since COVID started and before then, but in particular during this time frame. Our office will be issuing a press release shortly with more details on the application and eligibility process. We're in the winter months, and we want to do everything we can to prevent shutoffs and help low-income Rhode Islanders pay their water and heating bills. So these announcements are very important, lengthy announcements, but important. So I urge you, if you're eligible or you think you're eligible, to apply for this assistance and help us spread the word to those who may need a little extra support this holiday season. The more dollars that we get circulated into our communities, the more it helps the individuals that need it, but also helps our local economy, because you're circulating dollars that we're holding on to because we have to hear from you so that we can distribute these dollars. So I encourage you to apply. A short update on the Eleanor Slater Hospital. Joint Commission informed Director Charest today that it has awarded Eleanor Slater Hospital a status of accreditation. This is a change from the status the Joint Commission announced earlier this year following its June survey, which was an accredited with follow-up survey. Again, credit to the director, the staff, and everybody that's been involved with this very tedious but important process of catching up and correcting some pre-existing issues. So Director Charest, thank you, and thank you to all the staff that has worked on this. Based on the hospital's demonstrated progress, the Joint Commission has granted the status of accreditation with an expiration date of June 19, 2024.